familiar with this, is progressive and regressive, P&R, right? Angular isometric loading. And essentially that just means that we are loading this joint from the progressive and regressive angles, so front and back, essentially, right, in an isometric fashion. The goal of this is to increase your range of motion, but to also increase your strength through that range of motion, which allows you to access it at all times during exercises and be strong in those ranges. Okay, so most important thing I want you to keep in mind as you do this is you want to avoid closing angle joint pain. Okay, so that means that as you are moving toward a direction, you should not get pain or pinching in that direction. So for example, we're going to be here and you're going to be working this leg. So you need a band or a belt or something that doesn't move when you pull on it. This is a pretty thick band, so I'm going to just create a little tension on this and that'll be good enough. So from here, you can also double that. So from here, right, you should not be getting any pinching in the front of this hip. This leg's going to stay down, and your goal here, and I like this laying down position, you can also do this standing. I prefer this position because it allows you to feel what's going on with your back. You want to maintain a little bit of an arch in your low back. If you're pulling up so far that your low back is rounding out, right, we're not isolating this hip joint. That is compensating and moving into your spine. So you're going to maintain just a little arch and a little space between your low back and the floor, and making sure that you're not getting any pinching here in the front of this hip. Okay, you should feel a nice stretch up the back of this leg. The foot is relaxed, okay? You can, the knee is pretty much, doesn't have to be straight locked out, but it's not bending, and your foot doesn't have to be pulling back towards you. So I actually like the band to be a little lower on the heel so that the foot can stay relaxed. Pulling the toe back can create some nerve tension, which we don't really want to push into. So from here, okay, the concept is the same across the board if you've done these before. If not, we're going to go over it. So the sequence is a 2-minute stretch, a 15-second push, and a 10-second pull. So the push is out of the stretch, okay, but these are isometric contractions, so there's no actual movement when you push out of this. That's why you need something that doesn't move or doesn't give. If you got a band and you were able to actually push it, that would defeat the purpose. So we're not moving, this is an isometric contraction, and so you're driving into that band, right? Then the pull is going to be deeper into your stretch, and that is the regressive, okay? So we're going to pretend that we've held here for 2 minutes, okay? This is a nice, easy stretch. We're maintaining tension, right? As you hold in a stretch, you'll feel less and less tension, right? Go a little deeper into it. So we've been here for 2 minutes, okay? That's the first step. The second step, you're going to start to try and rip this band out of your hand or rip it away from you, okay? You're going to start the 1 pound at a time. So if you had a scale behind your knee, it would start to read 1 pound, 2, 3, 4, 5. Okay, we'll stay about there. So we're going to go about 50%, 50% for this first round. Once you get to your intensity, you're going to hold for 15 seconds, okay? So we're at 50%, about 50% of our max capacity, okay? And you're going to hold 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, okay? We held. We're going to slowly relax the leg. Now, we're going to try and create some slack in this band. So we're going to pull this toe back towards that wall. You're going to keep that tension, keep that space in the low back, okay? And you're working this quad to tighten that up and pull that foot back towards that wall. You're going to hold 10 seconds. 9, 8, 7, 6, 5, 4, 3. Still have space in the back. 2, 1. Recreate tension on your belt or on your strap here. Okay? Then slowly relax the leg. So you're working to pull yourself deeper into that stretch when you do that. Okay? That was 1 round. So your goal as you do this, right, is to increase the intensity throughout the weeks. So for the first week, maybe you start with 2 rounds, right, a 1.5 minute stretch, a 15-second push of about 50%, okay? And then the next week that you do this, maybe you go your full 2-minute stretch, never do less than 1.5 minutes, but your full 2-minute stretch, okay? Your intensity maybe increases to 60%, maybe 60, 70, and you go from there. So you're working your way up to 3 full rounds of a 2-minute stretch, maybe 70, 80% intensity, maybe 90, 100, depending on how you
feel on what days. You can vary that throughout the week. And then three full rounds of the 2-minute stretch, 80-90% intensity. Okay? So again, 2-minute stretch, we're gonna hold here for, right? We were here for 2 minutes, quote unquote. I'm maintaining that space in my low back, right? I feel this nice stretch up the back of my leg. You're going to drive your heel into that band, pull the band away from you without letting it go anywhere, so you're holding it strong. 1 pound at a time, 2, 3, 4 pounds, 5, 50%, maybe 60%, and now you're gonna hold it. Once you get to your intensity, we're holding 15 seconds, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 1, right? And now you're pulling that toe, that whole leg, tighten up the quads, keep this core engaged, nothing's moving here, and you're pulling this leg back, 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 back. If you feel like you can put a little assistance on this band and pull back deeper, but I want that engagement from this quad, right? The leg is doing the work, most of it anyways, with maybe a little assistance from the band. Slowly recreate tension, relax the leg, and you're holding your stretch again, okay? And you can find different positions, right? For me, if I pull my leg across the body, I feel a little more tension, like where I need it. You need to pull out a little bit, okay? We're not going all the way out to the side, that would change this, but you can play with the angles slightly to create tension where you feel like you need it, okay? So that is hip flexion, straight leg, PAILS,